Yes, 1 second, ma'am. Just
ವಿದ್ಯುತ್ ಕನೆಕ್ಟ್ ಮಾಡಿದ್ದೆ ಅದನ್ನ ಕನೆಕ್ಟ್ ಮಾಡಿ ಎಲ್ಲ ಥ್ರೂಔಟ್
Mr. Deepak, please, will you mute yourself, please? Yeah, thank you.
Somebody has to send to Rathina ji also.
Who,
Yes.
ma'am?
Same, ma'am. Same link. We are
Same
already
link.
shared, ma'am. Shared. Tell her. Given message to her.
I'm there, ma'am.
Okay, ma'am. So I would like to welcome today's sorry for the misconvenience to all. Today now I would like to call Bimla Kapoor ma'am. Next slide, please. Muthu, sorry sir, sorry. I would like to call on a guest of honor today, Muthu sir. He holded the situation very nicely and call immediately to Venus Hall and adjusted the things. Thank you, sir. Thank you. As today you are guest of honor. Sir is a president of a NSS Forsyth Year chapter and addition to the doctoral degree, MBA also, and in a hospital administration. He worked as a NABH consultant and as clinical coordinator and certified as a hospital for nurses. He has received many certificates and awards and training of a trainers had course in midwifery faculty development program from NRSC, Indian Nursing Council. He is certified as an international assessor for Kaya Kalpa, NQAS and MUSQAN. LAQ Lakshya, that is program, and he is also certified as a Lean Six Sigma, Green Belt, Yellow Belt, and Black Belt. Sir is a lifetime member of many nursing associations and societies like TNAI, QCI, and TI, NSS executives, and he is a certified of a master trainer of a simulation based of NRSC New Delhi. He organized national and international webinars in many sections at the academic as well as the administrative purpose. Next slide, please. So I would like to welcome sir to give a message on this midwifery day as the session has been continued. Yes, sir.
Thank you,
Welcome,
Swati
sir.
ma'am. Thank you so much. First of all, I thank our beloved patron, Dr. Khanna ma'am, providing me this opportunity. And even same, I would like to thank our Bimla ma'am, Asha ma'am, as Neera Sudha ma'am, and Urmala madam also, Asha Kurushi ma'am, and Binu sir. Always they are there behind us to conduct all these activities. And obviously, and I want to congratulate the entire team of Lily Chapter 2 for the great event. And as we know, India is undergoing a significant transformation in maternal and neonatal healthcare, with the midwifery playing a pivotal role in the evaluation recent initiatives and aim to professionalize midwifery, enhance educational standards, and improve services delivery across the country. Establishment of National Midwifery Training Institute already, I think most of the year 2022, the government of India collaborated with Japaigo inaugurated 2 National Midwifery Training Institute in Maharashtra and Uttar Pradesh. As already Neerja Sood madam already has talked about this. And even launch of National Nursing Midwifery NNMC Act, as Bimla madam is there, actually she only prepared the draft, and in that draft also the NPM, so many other things are there. As a part of that draft, even in Karnataka also, I think already we in Vane Vilas it is being established. By name it is called as MLCU, Midwifery Led Care Unit. A part of it, and already in Karnataka, in Vane Vilas it is practicing. Even in our KMC RI also, recently they are going to establish this MLCU. Already, I think for 18 months training, NPM, most of the staff they are recruiting and they are in the process. In Karnataka, midwifery and state level initiative collaboration in Karnataka state has partnered with the Astrika Foundation and UNICEF to establish National Midwifery Training Institute in Vane Vilas Hospital in Bangalore. This initiative will offer a 18 months nurse practitioner in midwifery program among the producer skilled midwifery professional who can provide quality care to women and newborn. The initiative also studies training midwifery educator to ensure sustainable and effective workforce. As challenges and the path forward, a shortage of skilled midwifery professionals and inadequate clinical training opportunities and integrate into the healthcare system. So with this, I conclude this thing and thank you.
Okay, thank you, sir. Thank you for giving a valuable message, and on this midwifery session, you have given this active participation. Next, I would like to call Urmila Bharadwaj ma'am has continued some topic and didn't conclude. So I would like to call first Urmila Bharadwaj ma'am to conclude her topic, as she was on the very basic point, that is mortality and morbidity rate in India, or maternal and infant rate. So yes, ma'am, welcome, ma'am, please.
Yeah, not to take it so long, we have lost some time in our internet this thing.
Yes.
I want to conclude. In India, there is no dearth of researches done in maternal and child health nursing, improvement of their health. But because there are, it is mandatory for many nursing to have a research, starting right from the BSc till PhD and postdoc. So it is there, but unfortunately, what happens due to lack of generalization or something like that, they are ornaments in library. They're just lying, or they're only utilized for the next researcher to give the citation. What I feel that researches which have good evidence, that there should be some committee at the national level which can authenticate. Yes, it should be put in practice. Many good researches are there, but they are not being practiced. Since in this platform, we have stalwart words of nursing profession, Madam Bimla Kapoor, Madam Asha Qureshi, Dr. Sukhanna, so many are there, and they can have a committee which can authenticate or work on generalization of such studies, and which can be put in practice. This is one of my points, that it is such an effort, so much of a work goes on in these researches. But I'm sure that many of good researches which has good evidence are not being practiced. In another thing, in many of the platforms, I have said that in line with Indian Council for Medical Research, ICMR, why can't we have ICNR? Nursing has been proved so much to elevate and to improve the health of the people in this world. We do not have. And when you go, maybe some here and there, they fund, they help, but it is not really enough. So I really say on this bigger platform that there could be some agency at the national level can collect all the researches and find out which are good ones, which can be generalized if need to, and can be put in practice. Because I feel research is done, if they are not put in practice, it's a futile exercise. Evidence, practice has to be there. Evidence has been created, but the practice part is missing. Another thing, every hospital, I'm sure well qualified nurse administrators are there in every hospital now. They can have a cell, like they have a problem solving cell, or they have some other cells. Why can't they have a research cell as well, that their findings in their hospital can be a model for other hospitals, so that they don't waste much of a time. They have a problem solving, little bit change in their steps will make a research cell, and they can always have it. Similar things can be applied in community health nursing, which includes midwifery, neonatal care, every aspect of life. So this is my observation. Many years, good researches are not being practiced. We can have, I again say that we can have Indian Council for Nursing Research at national level. We can have research cell at every hospital, every institution. We can have research cells in all institutions, and a apex body can be established which can authenticate and decide who to give fund, how much fund to give, and maybe those studies which are done for acquiring the degrees may not be able to generalize. So generalization of those studies can be done. Thank you very much, Dr. Swati, giving me again a chance to speak, because I was not dying to talk on the topic. I was dying to talk about my own thoughts about these things which are lacking. So thank you so very much. India is full of nursing professionals. We are very qualified, very strong in their research, and very good. So I thank you all very much, and thanks everyone. And thanks to my mentors, guides, teachers in this platform, the friends and our NSS executive members to give me this opportunity. Thanks again.
Thank
And
you, ma'am.
Yeah.
Thank you, ma'am. Thank you so much. We missed. It's very honor to give again the conclusion of the part that you have tell a very specific where we are lacking in the MCH program at in community based level and community health nurse, where the nursing is going in advanced research statistics and all centers, but it is not getting implemented at the ground level. The community health nurse is not implementing. So we are today having a great honor to know all the points where we are lacking in nursing. Next, I would like, thank you, ma'am. Thank you so much. Next, I would like to call Bimla Kapoorji, ma'am. Today, she is a respected.
May I request
Yes,
to
ma'am.
forget about the introduction? If you permit me, I can start
Yes, ma'am.
because
Yes, ma'am.
we
Yes,
had
ma'am. Yes.
little
Yeah.
technological
Yes.
error.
Yes, ma'am. Yes,
Okay.
ma'am. Thank you. Thank you,
so
ma'am.
much.
Yes,
Yes,
ma'am.
I think I am a Bimla Kapoor. I can tell everybody. So it's a pleasure to be part of the whole celebrations. Now, I just want to, I mean, we have speakers today who are going to do the presentation, but I thought I'll answer just two questions. One is that we are celebrating the theme of midwives, a critical lifetime in lifeline in every crisis. And I think we all should feel proud and congratulate ourselves that we have been contributing to the maternal health so much and to the child health. We also know that India goes through very unique challenges. We have disaster, we have, sometimes when a midwife has to go, a nurse midwife has to go and have a makeshift kind of a tent to deliver the babies. We also know that as midwives, we look after the antenatal, postnatal, and natal care, and also the care of the baby. We also become responsible as nurses to work in public health emergencies for the maternal and child health. Community preparedness is so very high in the midwifery that we look after. Suppose there is a disaster, suppose there is a block or accident, the mother and child we need to save. So right at home, we try to do that and manage even on the roadside, in the buses. You all know that, in the trains, the midwives have been able to do so much of a task. So what I'm trying to say is that it's very significant that we celebrate this day with certain convictions that the nurse-led, midwifery nurse-led clinic should not be very far off, because the midwife is the one who is managing all the care and delivery, whether it is mental health, whether it is small comforting the back during delivery, whether it is reviving the baby, or helping the mother to see that the placenta is delivered properly, at home, in the community, in any situation. So I think let us congratulate each one of us on this such an important day of celebration of midwifery day. And of course we have the nurses week coming very soon. Just to answer a question before I invite our speaker to do the presentation is, we had proposed ICMR in the bill, and ICMR, they said it is a huge infrastructure, we cannot have ICNR in the huge structure, but over the period we can think about the department under the ICMR. I said I don't mind that, but there should be a separate identity. Now it is who is going to be the chairperson. We are looking forward to that, and how much the person asserts for these kind of things, we need to support and guide whoever comes. Just with that, let me invite our today's speaker, and who's going to introduce her? Muthu sir?
Krishna.
Ma'am, Swati madam, I think
Yes,
next
yes.
second.
Introduce before I invite her, please.
Yes, ma'am. So, ma'am is Ratina ma'am, Dr. N. Ratina. Ma'am is a distinguished nursing professional with over 37 years of experience in clinical practice. And ma'am has served in military nursing services under the Ministry of Defense for 24 years and retiring with the rank of Colonel, and Madam has hold PhD in nursing, obs and gynae from Amity University, along with the qualification in MBA and hospital management. She has been a senior learning officer at the Indraprasth Apollo Hospital, New Delhi, where she is learning and development department. Her contribution were instrumental in achieving 3.0 non-compliance of JCI audits. Ma'am has published over 25 clinical research papers in the reputed journal. Ma'am has also served as associate professor and a nursing consultant for the commissioning of 2600-bed Amrita Institute of Medical Sciences in Faridabad. Ma'am continues to contribute to health quality as a trainer with the Quality Council of India. So I would like to welcome, yes, ma'am.
Thank you, Colonel Latima. Let me invite you for a very important topic, a study on effectiveness of mobility, on parturition, maternal satisfaction, and fetal outcome in labor room. I think nobody is more fit in the labor room than the midwifery nurse, because the doctors also rely upon the nurse who's there, and they keep on asking, when can we come and deliver the baby, when the midwife can deliver. But it is, I have seen in the labor room, the 3 round of cords around the neck, and the midwife in the labor room, a nurse in the labor room saves the life of the child, and the mother, stops bleeding. So I think your study is going to really educate us more and more of the latest finding. Welcome, and please proceed.
Thank you, ma'am. Thank you. Can I have my slides?
Yes, ma'am.
A very good morning to senior colleagues and also young leaders who are there with me today. Can I have my slides, please?
Yes, ma'am. Ma'am, Krishna, ma'am. Ma'am, you share, please. Sorry to say, ma'am, previously I have to give Ashia Qureshi, ma'am, as today's special guest message introduction for the special guest, that is Dr. Qureshi, ma'am, has been well known and nursing leader, seasoned publisher. Madam has been associated with the Galgotia University since 2014 till 2021. After rendering 45 years of services with AIIMS, she has credited a professional experience of over 50 years and completed her PhD in the public health nurse. She is also MBA from the Proudhon Institute of Management, Newport University. She joined AIIMS ND and year 1972, retired superannuation in the year of 2014 October. Worked at various capacities of PHN with the project clinical nurse, educator, administrator, researcher at AIIMS. Her area of interest includes community health nursing, nursing education, nursing administration. She has credited 30 research publications and national international journal awards. She has been awarded with the Mahila Shiromani National Award and President in the India for the best community and the patient care services, and Rajiv Gandhi Excellence Award, NRI Society India in Delhi, Health Minister. So I would like to call Ashia Qureshi, Dr. Ashia Qureshi, ma'am, as a special guest to give her message. Due to slide interchanging, it's missed, ma'am.
No, I will just speak. Okay. So thank you so much for the introduction.
Yes, ma'am.
Honorable, our patron, Madam Dr. Khanna ji, Dr. Bimla Kapoor ji, Binu sir, Nija Sood, our today's keynote speakers, Dr. Muthu ji, Dr. Urmi Bhardwaj, esteemed guests, esteemed midwives, and esteemed audience and dear friends. It is an immense honor to stand before you today as we celebrate World Midwives Week. So many speakers have told about various national programs, going on in India, but this is a World Midwives Week. A time is dedicated to recognizing the extraordinary contribution of midwives to the health and well-being of women, newborn, and the families around the globe. Midwives are more than healthcare providers. They are guardians of life, advocates for women, and champions of safe and dignified childbirth. Their role extends beyond the delivery room, encompassing education, emotional support, and empowerment for the mothers and family. Today, we acknowledge their unwavering commitment, compassion, and resilience. The theme for this year's celebration, midwives critical in every crisis. This is the theme of this year. This reminds us of the critical need to invest in midwifery. Studies have shown that increasing access to midwife-led care can significantly reduce maternal and neonatal mortality rate. Yet, many midwives face challenges such as inadequate resources, lack of recognition, and gender inequality. It is our collective responsibility to address these issues and create an environment where midwives can thrive. Now, why this theme is chosen? While midwives are vital to health system, ability to prepare for the withstand crises, they are often not valued and are excluded from preparedness, planning, and response efforts. This is a moment to position midwives as the essential health professionals. They advocate for their inclusion at every step of crisis preparedness and response. For midwives to adequately respond, we must also ensure they are safe and they are equipped with the training tools and resources. They need to save lives and protect rights in the most challenging setting. As we celebrate, let us also reflect on the progress made and the work that lies ahead. Government, healthcare institutions, and communities must come together to ensure midwives receive the proper training, tools, and respect they deserve. By doing so, we not only honor their contribution, but also pave the way for healthier generation. To all the midwives, nurses present over here today, and those working tirelessly around the world, I extend my deepest gratitude. Your dedication inspires us all. Let us continue to support and uplift midwives, recognizing them as the backbone of maternal and newborn care. Thank you all, and may this week be celebrated, be a celebration of your invaluable work and call to action for the brighter future. Thank you so much.
Thank you, ma'am. Thank you for your valuable words and for the session message. Next, I would like to continue with Ratina ma'am as today as is. So I would like to give hand over control over to the Krishna ma'am. Madam is a PhD in nursing. Madam is working as an assistant professor in AIIMS, Patna. And Madam has 18 plus years of experience, MSc in the community health nursing, served as a resource person, guest speaker, and paper presenter at various national and international conferences. Presented work as a prestigious platform like the International Council and AIIMS and Indian Nursing Council. I would like to give control as a master of ceremony to the Krishna ma'am. Now we would like to continue with the Ratina ma'am as a speaker. Today is note speaker. Yes, ma'am. Welcome. Yes, ma'am, please share. Continue. Yes, ma'am. Next slide, please.
So now, good morning, everyone. It's my great pleasure to welcome you all once again to this event. Today's keynote address is a much anticipated part of our event. So, Ma'am Ratna will share a valuable insights on how movement and mobility during and after birth can positively impact the birthing experience and postpartum recovery. So, please join me in giving a warm welcome to Madam Ms. Ratna. And the session is going to moderate by Madam Bimla Kapoor and Madam Ashi Krishi, Madam.
Yes, I think we already
Good
introduced
morning
her.
and welcome back again.
Yeah.
My
Mm.
study is on effectiveness of mobility on parturition, maternal satisfaction, and fetal outcome in labor room. Being a midwife, being in the army, we have always been independently working in the labor room. So scientifically, I just wanted to know something that I can give my patients so that I can give them a safe delivery. That was the aim of choosing this particular topic for me. Okay, as all of you know, pregnancy is the only place where there is hell and heaven. Hell in the sense that the severe pain that the maternity lady takes place, and heaven is the joy of holding the newborn in her hand. So again, when we discuss about pregnancy, next slide, please. It is a lot of changes mentally, physically, and physiologically, which is a challenge for the woman, and also being in the new environment in the labor room and the problems that a lady encounters in different various labor settings is always a challenge for the woman as well as the healthcare professional, and the ultimate aim being the safety of the mother and a healthy newborn. So physical and emotional changes, there are a lot of review of literature, and it is important for all midwives to understand the woman who is pregnant undergoes lot of physiological change and also biochemical and biomedical changes that she has to handle. And we as nurses, midwives, and with the support of the family will help the woman to overcome all these challenges and lead to a healthy newborn. So according to many recent and very old researches, mobility is a non-pharmacological intervention which can be adopted by any healthcare provider, maybe midwife or any nurse in the labor room or all the healthcare providers that will help us to progress the pregnancy. There is less pain, less complication, and most importantly, she will be having a normal vaginal delivery. So this is basically the aim of mobility. Okay, so the need for study is labor, as you know, is a normal physiological process. We as midwives need to support that. Institutional delivery is being enhanced, and we are making sure that almost all ladies, starting from ASHA workers to everyone, are encouraging women to have institutional delivery for simple reason. We have a backup to support maternal and also the fetal outcome. And there have been a lot of monitors these days, and there were a lot of medications which are available, which ultimately lead to some other complications and inhibit mobility to certain extents, which is again a normal process, physiological process, which will enhance a normal delivery. So that is need for us to understand.
Dear
Next
Rajita,
slide.
yeah, just to request you, as we are running short of time, can you straight away go to methodology and talk out the outcomes? Because we would love to know that. It's just the time shortage. Otherwise, we would love to hear every sentence you speak.
Okay, sure, ma'am.
Thank you so much.
Methodology slide, please. Next. Yes.
Thank you, dear.
It is research approach. Design was a quantitative research approach, non-randomized controlled group post-test. The settings and population was women in active labor reporting in Swami Dayanand Hospital, Delhi labor room, where the accessible population. Sample and sampling technique were 240 antenatal, that is 120 experimental, and 120 is the control group with purposeful sampling. And tools and methods where the demographic data was collected. And of course, we were monitoring the pain with Magdal scale. And also we were using the basic WHO partogram to observe the maternal and the fetal condition. And we had an obstetric parametric scale where the assessment was done post-delivery also. So the analysis was descriptive statistics and infectious statistics. Next slide. Okay, we can just skip this review of literature. Just to summarize,
Go to the results. Go to the outcome, please.
Okay.
Thank you so much.
No, further down. Just a minute. I'll have this above slide. Above slide. Just to tell you about the intervention map, which is important in the study. Settings and other things I have told you. The primary gravida women who are who were in active labor were asked to be mobile. They were asked to walk for 20 minutes, rest for 10 minutes, where we were monitoring maternal and fetal condition. And the inclusive factor was being primary. There is no maternal and fetal complications, and their membranes has to be intact in order to undergo this procedure. So we were, I have given them to walk for 20 minutes, 10 minutes in left lateral position, monitoring. And after that, till the membranes are ruptured or till the time they are in active labor, they were allowed to be mobile. So this was the basic intervention which was given, which is important for the study. Next slide, please. Go. Please skip this slide. Skip. Okay. The graph. Okay. The above slide. Yes. This. Next. Yes. This is the perineal outcome, and you can see that it was significant. The mean perineal outcomes was not very significant. Experimental group was 5.32 and the control group was 3.5. 5.34. The research hypothesis was not accepted in this case. Regarding the perineal outcome, this is simple reason that any woman in labor room are continuously monitored. We do not leave them just like that because they are undergoing research or implementation. So this was basically that all women in labor room are continuously monitored and the best practices are adopted for maternal and fetal outcome. Next slide, please. This is the vaginal delivery, which was 106 out of 120. And in case of control, it was 87. This was again very, very significant. And the hypothesis was accepted because this shows that mobility had a great impact on the normal vaginal delivery. Among the other patients in the experimental group, they did not have cesarean sections, but they had prolonged long stage where they had to give a vacuum or a forceps delivery. Whereas in case of control, only 87 of them had normal delivery. Other 33 people had other instrumental and cesarean section, which is very important in this study. Next slide, please. This is the significance of a woman who adapted mobility. There was the p-value of the prolonged labor requiring intervention in case of control group was much higher compared to the experimental group. And the asphyxia of the newborn, which you can again see in the experimental group, it was less. And in case of control group, it was 33, which was higher, which is very, very significant. Next slide, please. The pain scores. Again, with mobility, there is a natural way of, with the contraction, the fetal head gets engaged. And mobility as such will cause the person who is walking is not concentrating only on the pain. They are with other activities. So they are not concentrating only on the pain. So the pain which was monitored in these ladies were mild, moderate, and severe. So they did not have much pain during the active stage of labor, and they were able to tolerate and they were able to progress well when there was full dilatation. They had enough of stamina to push the baby or get involved in the active labor. Next slide, please. So the mean outcomes that is very, very significant is that there was a maternal satisfaction that was based on the perineal outcome.
Excuse me, ma'am. Sorry for interruption. May I request all the audience, please, or the experts, please switch off your mic because we are having a very important presentation. Please switch off your mic.
Yes,
Please
ma'am.
switch off
Rishabh,
your mic.
Mr. Rishabh, please mute yourself. Mr. Rishabh, Mr. Rishabh, please
Sorry, madam,
mute
continue.
yourself.
No,
Sorry, madam, continue.
the maternal satisfaction was based on the type of delivery, the perineal outcomes, and the neonatal outcomes based on your APGAR score and the breastfeeding of the newborn. So this was also very significant, as you can see, and the hypothesis was accepted. Next slide. The fetal outcomes, again in the experimental group and the control group, there was variation, and there were very few babies who had to be admitted in the neonatal unit post-delivery. Whereas when a lady had a normal delivery, the neonatal outcomes were good and they did not require any active intervention post-delivery. Next slide. So this is the APGAR scoring, which was there in both the groups, experimental and control. Almost all 120 babies did not require any active resuscitation by the pediatrician, whereas only 87 was in the control group. So 33 babies had to be sent to the for neonatal resuscitation and to the neonatal unit. Next. So initiation of breastfeed, out of the 120, 106 babies were having normal breastfeeding within 2 hours, whereas in the experimental group, around the rest of the babies, since they had an instrumental delivery, it took a little more than 2 hours. Whereas in case of the control group, it was much more higher, which was again very significant. Next slide. So the study findings are very supportive that mobility is a very effective intervention for a normal vaginal delivery. We can just skip all these slides, please. We can go to the recommendations. Yes, above slide, please. Above. Yes. Above slide. Yes. So the study was conducted in one government hospital. As a result, the variance of the samples could not be ensured. Extraneous variables like age, height, and weight, qualification, level of understanding of primary partition couldn't be controlled because it was only in one setup. Socio-economic background and data could not be generalized in particularly in this particular study. Next slide, please. So the result in the study implies that more research on developing protocols for mobility can be framed and tested, testing the effort of mobility for women who are given analgesics during birthing process, and also the association between mobility and maternal fetal outcomes. And research can then take the test of challenge to provide the pace when women, as we had already discussed, this can be implemented in the labor room, which is well proven. Next slide, please. Though again, it is very much having implication in nursing and midwifery practice. Midwives, most of our primary health care centers and general hospitals are always managed by nurses. So just making sure that the inclusive criteria they have understood clearly and encouraging mobility to the woman, at the same time monitoring the maternal and the fetal condition for the safe delivery has to be encouraged wherever new midwives are there to help in the labor room for delivery. Next slide. As we already discussed, curricular enhancement, continuing of education, because what is difficult in nurses is to unlearn. And basically what we have to do is to learn, irrespective of many of you must have seen in the labor room, I've been here for such a long time. They don't want to unlearn and they keep practicing the old practices, which we have to make a cultural change and make them reinforce. We must make them understand the importance of the study and how it is going to impact our patients and our profession. And interdisciplinary collaboration, because again in labor room we don't work as a single hand.
Please, all of
do-
you mute yourself. Oh my.
We do have multiple
There's a road
people
message kara
to
do.
support us, so it is important to educate them and get their support as well. Next slide, please.
Mr. Rishabh, please mute yourself.
So again, recommending hospital policy
Rishabh,
makers to
Rishabh Upadhyay, please mute yourself.
और मैंने 5 जाने करी करो वाले Mr.
So
Rishabh,
many
reason
people
कितने
are,
5 जाने
unmuted. Please mute yourself.
so
recommending.
Excuse me, ma'am, just a suggestion. Can the host,
Swati, will you please
Yes, Priya.
mute him from your side? You are the host, no?
can the host
મારા
mute?
પપ્પાની તો બહુ વર્ષથી 10, 12, 15 વર્ષથી ભરાય છે કે સેના LIC ના હપ્તા ભરે. તો ઘણા
2
બધા
વર્ષ થઈ
પૈસા-
ગઈ
હે?
2 વર્ષ 2 વર્ષ में કેટલા
So
1 લાખ
policy
ઉપર
makers should understand and
ये
try
काम तो
to
भाई
adapt this.
वो क्या
Only
8
when
10
the
रुपए
policies
पड़वाना है
are
पासे
laid
18
in the labor room,
25 लाख रुपए मिले
then
को
I
only
think one
we can
person is not muted, who is lot of
40
noise
40
is coming.
55 तारीख को મળે એમ કોઈ કહે છે
I'm just
Oh my God.
requesting the host can mute him. Otherwise, just put him in the waiting room,
Swati?
तो पहले चीज बंद થઈ ગઈ क्या पैसा एक बार आदर्श में डाले थे घर में आदर्श क्रेडिट कोऑपरेटिव थी हमारे वहां पे
Please
7-8
continue
लाख
with your
रुपए डूब
louder
गए
voice.
बंद हो गए
Oh,
तब
okay. So
Mr. Rishabh,
my slide
बहुत लोगों के
is
पैसे थे
basically we should know
सब
that
ओरिजिनल
this
दिखती है वैसे सब
research
चलती है अच्छे से
has
लास्ट
an
साल 20 साल
impact
किसने
and
देखे
it
थे
has
तो मालिकों का कोई
to
मर
make
जाएगा
a
तो
change
मान
in
लो क्या
our
भाई
labor
पैसे
rooms. This only can happen if the policy makers adapt this in
रात
the
तक पे जब
labor.
आने वाले होंगे पैसे देने का टाइम आ रहा होगा अब सबको देने का टाइम है
Not help.
मर
So
जाएगा
we have to
तब वो
convince the hospital
बंद कर
and the
देंगे मान लो
policy
policy
makers
तो
to
पैसे मिला
adapt
के खत्म
mobility,
तब कल पीक टाइम एक साथ नहीं आने वाला सबको देने का
mobility so that
उस
it
टाइम पे
can
लास्ट में
also reduce
कहाँ
the
सबको 20
average
लाख
length
25
of
25 लाख
stay
रुपए
in the
देने के साथ
hospital.
Rishabh Upadhyay,
गप मार देंगे
please
सबका
mute yourself.
5 साल पहले बस
Hey Rishabh,
Rishabh,
Mr. Rishabh.
I can see Rishabh there is noise from Rishabh side.
मैं तो पैसे डबल
Rishabh,
Rishabh Upadhyay,
I think
the host can mute them.
Okay,
Yes, ma'am.
carry
I
on,
think
please.
he is muted.
Carry on, please. Carry on.
चाय खा लिया तो आबान खाया
Ayyo.
I identified you, Rishabh.
अच्छे रेट में मूड खुल जाता है
Okay.
normal delivery will reduce the average length of stay in the hospital. It is
Okay.
always
शादी मारा वो बता
good for the mother
Scooty
as
don't
well
have.
as the fetus. There will be in
ठीक
their
है
home
अपने हाथ में
environment
कुछ
Oh
less
my God.
chances of infection
तो घर वालों
and
को एग्री होना
consistent
चाहिए बस
planning and
घर वालों
implementation
को
in the
क्या
labor
Shimla,
room.
ma'am.
Ma'am, 1 second, ma'am. 1
Shimla,
second.
ma'am, can I give one
I
suggestion?
think we have to check we have to
Asim,
check
one second.
whether some outsider has joined.
Mr.
Shimla,
Deepak.
ma'am, just
We have
one
to check the
suggestion.
list if there is
No,
any
who is the
outsider.
Deepak?
Shimla, ma'am,
भाई
one
2 तारीख को मेरे
suggestion.
दौरे बांध रहे
Deepak sir is the host.
वो
Deepak
1
sir,
तारीख को वहां पे जाना
you can
लड़की के
mute
वहां
him,
पे दौरा बांध
Deepak
रहे
sir.
मैं कह मतलब बैठो यार शांति से क्या
Deepak
Deepak
sir,
sir,
just
you
put
can
him in the
mute him.
waiting room.
आपके पास फोन नंबर नहीं है क्या इनके सही
No,
कॉल
we don't know. No, Deepak sir, you can mute him, sir.
मुझे
You are the
जावान
host
तो
now.
क्या जावान
Sir, many times, many outside
Deepak
people,
sir, you can
outside
make me
is
host.
joining
आ
this
जाओ
group.
छोटे मोटे काम होगा तो तू देख लेगा मैं कहा ठीक है मैं शुक्रवार जाने वाला था
Somehow this
Okay.
is
अपनी
list
बैठ
seems
तो
to
क्या
be
प्लान
some
बना
outsider.
के अभी रहने दे रविवार को आना तो बस शादी के
Sandeep
बाद
sir.
I
वर्क
think
ऑन
let the
उठाना वो
speaker, have you
उठाएगा वो
concluded
पूजा भी
here?
है
Would you like
Sandeep
to
sir.
Next,
बाद में
conclude?
next,
लेना
next slide, please.
Just
Next
conclude
slide.
it.
ठीक है
Try to override
Next
his
slide,
voice.
please.
रविवार जो हम तो
Next
आज
slide,
जाऊँ तो रात
please.
आज से जो लोचो आएगी काल सवार
Yes,
निकला
please. So let us
So
conclude it fast.
the result
वो
of
वही
the
5:30
study
बजे के
has
आसपास
evidence to practice mobility in labor room. The community has to start appreciating, and this has to start during the antenatal period, because again, most of the women who are coming in the hospital are having some guidance, because all our doctors outside, irrespective of in the hospital. So they will tell, do this, do that. So it is very important to start from the antenatal period, educate the expectant mother that how mobility is going to help her, how she will have less of
I think
pain,
you remove
and how
from the group.
and how it is going to impact her maternity life and the healthy newborn. So just talking to patients will have a lot of impact, that is prepare them before they come to the labor room. So this will help them, that whoever healthcare profession are supporting them, they will be in a position to understand how important mobility is when they are coming to the hospital. Next slide, please.
17 kilometers, 1/7, but follow. I think this is some outsider. Some outsider has joined our group.
दीपक सर को बोलो मेरे को होस्ट करने के लिए, मैं आई विल रिमूव हिम।
Maternal,
remove Rishabh.
10 बजे के आसपास 10 साढ़े 10 बजे वहां
विनू
से
सर,
मोतीबाग सर्कल आता है। मोतीबाग सर्कल से उनको बस मिलती है, अंदर से जो बस आती है
सर इज देयर
I
ऑन
वही बस
think,
वहां से मिलती है।
Somebody
sorry,
वेट करना
for
पड़ेगा।
all the
non
बस यार
NSS
10
member.
15
Hello?
मिनट कौन के बस
Somebody
Hello?
मिल जाएगी बहुत
non
जल्दी। वहां से उस बस
NSS
में बैठ के
member.
जाता हूँ मैं डूंगरपुर से, फिर
दीपक सर,
जाता हूँ
सर इज नॉट
तो मान लीजिए डूंगरपुर बस स्टैंड हो गया।
Hello, Rishabh
विनू सर,
Upadhyay. Please mute
विनू सर,
yourself.
वहाँ पे
Rishabh Upadhyay, please mute yourself.
yes, he has finally done it.
Oh my Lord.
okay,
Okay, I think
yes
So,
let
There
us,
was so much of disturbance in such a good study, you
okay.
know.
Okay, let us congratulate. And sorry, we read your slides all right, but we missed your sweet presentation at certain points because it got muffled with the disturbance what we had. My only thing is that I need to really congratulate you on this day of the Midwives Day celebration, because you took up a study with a very small issue though, but it has helped the mothers to deliver normal babies, to have less complications, to be more, comfortable. So the study is very good, and you can, if it is published, so kindly let us know the journal in which it is published, so we can read through it more and more, because this is a very significant study for us, and it is total nursing intervention. That's what it is very important. Asha Qureshi, would you like to add a sentence?
just a minute, ma'am. I
Ratna ji,
just the pilot study has already been published in a Scopus journal, which is SAGE, and this will be almost it is ready. It will be published very shortly, ma'am. Whereas everything is there, which is already published in a Scopus journal, that is SAGE in the Midwifery Journal.
Thank you, dear. Thanks. Asha, would you like to add a sentence?
मैम अनम्यूट कीजिए अपने आप को।
Asha, unmute karo.
Ma'am, I would like to invite Dr. Bimla Kabur ma'am for sharing her
okay.
feedback.
Now, can you hear me now?
Yes, ma'am. Yes.
Yeah. Congratulations, dear Ratna ji, for your beautiful study, which has to be now, it is published, and I think we can implement it also at so many, most of the primary health center, community health center, sub-center, the deliveries are taken care by the professionals in the hospital setting or the community setting. So this practice should be implemented now, because now many places this practice is implemented. In Ballabgarh, in our community health center, when I was going there, we always used to tell the mothers to move around, take rounds, and then monitor them. This practice was going on at least in my hospital in AIIMS, and now I think we can see that it should be implemented at all levels now. So beautiful study. Thank you so much for highlighting, but there was a lot of disturbance, and still, you did a good job. Thank you. Congratulations.
Thank you, ma'am. Thank you.
Ma'am, I'm inviting Dr. Bimla Kapoor madam to share her valuable feedback, ma'am.
I think I wanted to cut short. That is why I gave a fast one. Because I really enjoyed the study in spite of disturbance, because I was reading it, because I found it through and through a nursing study, and she has published it also. So please find the reference and read it, because this small little task of nurses contribute to the health care of the mother so much. It makes her delivery comfortable. It makes her comfortable. A small comfort which I got 44 years back, 45 years back, was just my student nurse. She came and massaged my back when I was having a delivery. I have never forgotten that. So please don't think that these are small things. These are very important things for
Very
the mother who
important.
is in labor. Congratulations once more, and we are very happy that you have taken nurse-oriented study. Thank you so
Thank
much.
you. Thank you, ma'am.
So next we'll move on to the next session. It is going to deal by Ms. Kushi Tyagi, and get ready to be enlightened. Kushi Tyagi will take us on a journey through the history of midwifery in India. So she is pursuing right now MSc Nursing first year from the pediatrics from IIMT University. Is having 1.5 years of experience as a nursing tutor, and she is involved in ERP projects. And now let's hear from her now. So I would like
Hello,
to call.
everyone.
Yeah.
Hello, everyone.
Over
Good
to you.
morning to all of you. Hello, everyone. Good morning to all of you, my seniors. First of all, I would like to thank you, Mrs. Swati Patanwal, ma'am. She gave me the opportunity of She gave me the opportunity, and she has been with me since the beginning of my career. Thank you, ma'am. And now we will present. Okay, historical perspectives of midwifery in India. Okay, first we will start introduction to concept of midwifery and obstetrical nursing. Midwifery. A midwifery is a person who, having been regularly admitted to a midwifery educational program duly recognized in the country in which it is located, has successfully completed the prescribed outcomes study in midwifery and has acquired a requisite qualification that registered and or legally licensed to practice midwifery. Next slide, please. Okay, next is obstetrics. Obstetrics is concerned principally with the phenomena and management of pregnancy, labor, and the puerperium under normal and abnormal circumstances. Okay. Historical perspective. Midwifery is as old as history of human species. Archaeological evidence of a woman starting in children supporting by another woman from behind demonstrated the existence of midwifery 5000 BC. Okay. Aristotle 384 to 322 BC, the father of embryology, described the uterus and the female pelvic organs. He also discussed the essential qualities of the midwife. Hippocrates 460 BC, the father of scientific medicine, organized, trained, and supervised midwives. Hippocrates believed that the fetus had to fight its way out of the womb and the membranes. The efforts of Hippocrates were not appreciated by the midwives. Soranus, in the 2nd century, was the first to specialize the obstetric and gynecology. His book was under of 1,500 years. He used the vaginal speculum, advice on cord care and wet nursing. Okay, next one. Leonardo da Vinci, 1452 to 1519, made anatomical drawings of pregnant uterus. Vesalius in 1543 opened the full-term pregnant uterus in lower animal, accepted the fetus and demonstrated uterus as a single chamber organ. Ambrose Paré, 1590, laid the foundation of modern obstetrics. He performed internal podalic versions and skillfully delivered women. He was the first to deliver a woman in bed instead of the birthing stool. He also sutured perineal lacerations. Ambrose Paré founded a school of midwives trained by Paré, attendee of the ladies of the French court. Jesus Cassier Arrangi wrote the first book for Italian midwives, which ran 17 editions. He advised cesarean section for contracted pelvis. He described the raw placental surface and initiated the study of uterine sepsis. The French King Louis XIV in 1663 employed a Paris surgeon to attend one of his mistresses in labor, and pleased with the result, the king honored the surgeon with the little accounters, a person who assists women in childbirth. Moratio in 1668 published a treatise on midwives. Chamberlain in 1675 designed obstetric forceps. William Smellie, 1697 to 1763, is called the father of British midwifery. He explained labor to be a mechanical process and described collimetry, cephalometry, and forceps delivery of the after coming head of a breech. The chair of midwifery was founded in 1726 in University of Edinburgh. John Leake, 1972, replaced the obstetrical stool by special delivery beds. Charles White in 1773 started the puerperal fever was infections. He used lime as disinfectant and clean linen, isolation, adequate ventilation, and sitting posture to facilitate drainage. Fielding Ewell, 1710 to 1789, described the mechanism of normal labor and performed the first episiotomy. Gordon in 1959 described puerperal sepsis as a wound contamination of placental site. Laennec in 1816 invented a stethoscope. Francois on 1818 first recognized fetal heart sound in a pregnant uterus. James Young Simpson in 1847 used chloroform first in obstetrics for anesthesia. Florence Nightingale in 1862 organized a small training school in connection with King's College Hospital, where she conducted training for midwives. Semmelweis in 1861 demonstrated the cause of puerperal sepsis and suggested preventive measures. Louis Pasteur in 1879 wrote the thesis on puerperal sepsis, demonstrating the presence of streptococci in lochia blood and in fetal cases in the peritoneal cavity. Spencer and Blatny promoted the concept of antenatal care of pregnant women. Franz Moratio, a French obstetrician, first reported cesarean section in 1668. Porro performed subtotaloctomy in 1876. Max Sanger, 1882, first sutured the uterine walls. In 1912, Freund introduced lower segment vertical incision, and it was popularized by D. Lee in 1922. Munro-Kerr in 1926 introduced the presence technique of lower segment cesarean operation and popularized it. 19th to 20th century. Up to 1935, the midwives attended 50% of birth, and it slowly declined to 12.5%. The doctors convinced people that the midwives were dirty, illiterate, and ignorant, and the mothers would be safe only in the hands of physicians. Gradually, by the 20th century, the midwives lost their importance in the society. In the 20th century, the physicians started being trained in the specialty of obstetrics. Okay, 19th to 20th century, hospital is considered as a good place for birth, but evolved from physiologic event into the medical procedures. It was a project as a dangerous process because of pathological conditions requiring a program of routine medical intervention, including anesthesia, episiotomy, and instrumental delivery. Development of midwifery in India. In ancient India, the untrained guides were responsible for conducting delivery. This system leads to various complications and increased maternal and infant death. 1885, an association of medical aid by women of India was established by the Countess of Dufferin. Training of guides were established in 1903. 1918, Lady Reading Health School was started in Delhi, offering health visitors course, which was another stepping stone in MCH services. Development of midwifery in India. Again, 1921, Lady Salford League was formed in India for developing maternity and child welfare services. 1931, the Indian Red Cross Society established MCH Brew in association with the Lady Chelmsford League and Victory's Memorial Scholarship Fund, and coordinated the MCH work throughout the country. 1938, Indian Research Fund Association was established, which performed a committee that undertook the investigation into the incidence and cause of maternal and infant morbidity. Next is development of midwifery in India. Again, 1911, A&M programs was started. 1931, Indian Red Cross Society stabilized the maternal child health view. 1914, starting rooming in. Nurses League, and in 1946 had two boards of nursing education, the Mid India Board of Nursing Education and the Board of Nursing Education. 1947, India Nursing Council enacted and INC constituted in 1949. Okay, next is trends in maternal health services. Current trends in midwifery and obstetrical care. Midwifery, a separate profession. Next is entry in midwifery practice, a degree in midwifery from university. Independent nurse midwifery practice. Next is epidural analgesia in labor. Positioning during second stage of labor. Birthing centers, the midwifery-led birthing unit. Team midwifery practice. Family-centered midwifery practice. Women-friendly services. Complementary and maternity medicine. And last is natural birth. Thank you, ma'am.
Wonderful, wonderful.
Thank you.
Okay.
Now, I would like to invite Dr. Isaac Rishi, ma'am,
Yeah.
for share her feedback, as well as Dr. Bimla Kapoor, madam, to share her feedback. Now, the floor is yours.
Yeah, Khushi, you have done a great job. You have updated our knowledge, all of us, you know. The detailed history from the very beginning till now, you know, is marvelous. Your presentation is very good. And I think it must have taken a lot of effort by you to collect this information, you know, that is wonderful. You have done a wonderful job and updated. We are all updated, you know. This history was very good and she has presented so well. So thank you, Khushi. Thank you so much. Congratulations.
Thank you, ma'am.
Just a question, Khushi, have you finished collecting data? Hello, Khushi?
Yeah, Khushi?
Yes, sir. Yes, sir.
Have you finished
Hey.
collecting data? You are a first year student, no?
No, ma'am.
Hey, light us, ma'am.
Sorry?
My session is starting in August and September, ma'am.
Sorry? Cannot
I
hear
think-
you. I think your voice is
Madam is
breaking.
asking something.
Because
Khushi, are you first year student or MSc first year student?
MSc first year
I'm
student,
first
ma'am.
year student.
MSc first year.
Pediatric degree specialty, ma'am.
Okay.
Wonderful.
Sorry?
Bimlaji is asking some question from you.
My question is, have you start? You are a first year student. Is that right? First year MSc nursing.
Yeah.
Okay. Somebody can
Ma'am,
answer
she's-
that
she's in
question
first year
because
MSc.
as
She's in first year MSc, it seems, ma'am.
so that means she has just submitted a synopsis. She has not collected any data.
No, ma'am. I think Krishnaveni ma'am can help you in this. Krishnaveni ma'am?
Sir, actually, Swati ma'am only knows, sir. Actually, I came to know that
Okay.
by
No,
the
not a problem.
Yeah.
Not-
Yes, sir.
Okay, that's all right. Doesn't matter. That's all right. Let's stop here because as first year MSc nursing student, to me, I felt that she's giving an overview of what she is going to do because the data collection will only start in second year, semester 3 and 4.
Yes,
And
ma'am.
so first and second semester, it is approval of the synopsis. So I'm
But
sure
Bimlaji, this
she's
is not a research study, no? This
It's
is
just a review, ma'am.
She's given
Just
a
a review
review of
article.
history and all, that's all.
It is a review. It's
Yes,
a review,
ma'am.
but she should take it as a review only, not as a part. I mean, it's a part of a review of literature. If I have understood clearly. But if there are any doubts, I'll clarify from Swati later on. Let us move to the next, please. Congratulations, dear Khushi. Young girl, go ahead, do well.
Yeah. Thank you, ma'am.
Thank you, ma'am, for your valuable feedback.
I'll clarify from Swati later on, not now. Please go ahead with the next. Thank you so
Yes,
much.
ma'am. Thank you, ma'am, for your valuable feedback. Now it's a time to celebrate excellence. So our pattern will now induct deserving individuals into the Hall of Fame, acknowledging their extraordinary achievements and contributions. Now I would like to invite Madam, our pattern, Sue Madam, for this.
Thank you, everyone. And we had patience in spite of these glitches. I would just like to have 2-3 minutes. Rumaji said she's ready with the videos, clips. So if she can play one more time, we can give her 2-3 minutes. Rumaji?
Yes, ma'am. Yes, ma'am. Ma'am, I'm
Yeah.
sharing.
Play them.
Someone else is sharing. हम बोलते हैं stop करने.
Yes, Rumaji, start.
Yes, ma'am. I'm doing.
He worked so hard on it, so I don't just want to leave it without, if you can. Happy birthday to our mother of the profession, Miss Florence Nightingale. Happy birthday. Happy Nurses Day. And
Everyone can
to
see?
everyone to put their effort
We can.
on the theme
Oh, okay.
of 2025, Accelerate Action. Women's power, nurses' power, nurses' right, gender equality. So please go with the flow and go with those sub-themes and enjoy and celebrate. Happy Nurses Day, Happy Midwives Day, and happy birthday to our mother, Florence Nightingale.
Wow, good. Thank you, Dr. Khannaji. This was your voice, I think, not Ruma's voice. Beautiful, beautiful. Nice.
Okay. Much enough fun.
Yeah, ma'am. Next slide, I think I will share. Then you can see this one all here.
Maybe.
Yeah, ma'am. Induction in the Hall of Fame.
Yes, we just went through her profile, Dr. N. Rathina. It is spelled a little bit wrong. I'm being corrected. She is such an pro that in spite of so many glitches and all, she kept her calm. So congratulations to you for presenting and for your contributions and for your publications. So keeping all this in view, you are highly recommended to be in our Hall of Fame. And we congratulate you from NSS family. And we will have our little bit oath after I read two more people's CV, and we will do the oath together.
Thank you, ma'am. Thank you, ma'am. Grateful.
Congratulations, Rathina.
Thank you.
Okay, next is our Honorable Dr. Dhananjay. He is coming very highly recommended, though he is in the healthcare system. But in Maharashtra, he really and nursing friendly and community leader. So I will just say current role.
Already garam
Yes.
Again, he started. Will you please mute yourself? We are getting disturbed.
Ma'am, I have
Whosoever
muted.
is
Ma'am, I have
talking.
muted. Ma'am, I have muted.
Dr. Khanna, you are muted. We can't hear you. Please unmute yourself, Dr. Khanna. No. We still can't hear you. You have to unmute yourself, please. Yes.
He's unmute. He's muting me instead of. Anyhow, so bringing his contributions and working along with the nursing leaders, I think he deserves to be in our Hall of Fame as a community leader and as an associate professor and associate member. Yes, I like that. And I know he will be promoting our mission also when he is going in and meeting this community of people in healthcare system. So, Dr. Dhananjay ji, are you there?
Yes, ma'am. Yes.
Yeah.
Thank you
Would
very
you
much.
say something for us?
Yes, yes. Thank you. Thank you to the organizing team. And thank you, Dr. Narula Khanna, patron, for the kind introduction. It's my pleasure and honor to be here for getting inducted in this prestigious NSS Hall of Fame. I'm thankful to NSS patron Dr. Narula Khanna and President Dr. Binu Joy sir for accepting Dr. Swati Raniji's recommendation and valuing my community services, which I will contribute with the nursing profession, represented by many nursing leaders, especially Dr. Swati ji. My best wishes to the other inductees, and thanks to Lily Chapter President, Mr. Sandeep Karavasara, and his talented executive team for inviting. Thank you, all of you.
You're welcome.
Congratulations, sir.
Yeah. And the next one is Mahesh Gadagji. I asked him to read his own CV quickly. Mahesh, are you on? Mahesh, unmute.
Good morning, everybody.
Yeah. Good morning.
On this International Midwifery Day, we celebrate midwives, the first torch bearers of nursing care, who blend science and compassion at every start of life. And it gives me an immense pleasure to introduce myself. So currently, I'm working as a principal at the Sana Institute of Health Sciences, Hubli, and I worked as a associate professor, assistant professor at Cayley Society Institute of Nursing Science, Hubli, and I worked as a clinical nurse educator at Cayley's Dr. Prabhakar Kore Hospital. And presently, I am serving as an academic council member at a prestigious health university, Rajiv Gandhi University of Health Sciences, Bengaluru. I have done my master's in the field of psychiatric nursing at Cayley University, and I was awarded as Kannada Seva Ratna Awardee, and have got a LIC inspector certified in Rati, ENLS training, and the FCM. So with this brief, I would like to say a few words on this. So as we all know, Midwifery Day, we celebrate the spirit of nursing, a spirit that midwives carry with unmatched dedication and compassion. So here, the world of nursing midwives hold a sacred space. They are the first caregivers, the first healers, and the first hope of new beginnings. So I'd like to extend my warm greetings to the team of NSS and Khanna madam for introducing me here, and the Binu sir for your encouragement, and my close friend Dr. Muthu here. I'm very happy to see you, growing in a very hard way. And with this brief introduction, so I must say thanks to everybody who all have taken a part and enriched our knowledge in the on the occasion. So thank you, everybody. Have a good day.
Sure. Is Binu sir there? Muthu sir, is he there?
Binu sir, I think Binu sir is not there, ma'am.
Okay. Asha ji, would you like to read it or should I read?
Yeah, I can read, ma'am.
Yes, ma'am.
Please. Yeah, share the slide.
Yes, ma'am.
Yes, ma'am, it is there already.
Let's proceed to the vote taking ceremony. I would like to invite Dr. Asha Krishi madam to do this. Thank you, ma'am.
I will do it. Okay.
Yeah, thank you, ma'am.
Yeah. I'm reading it. Okay.
Yes, ma'am.
And you all have to say I do. I solemnly pledge myself as an inductee of Hall of Fame of NSS that I will honor and cherish the valuable award by showing my allegiance to the society. I will uphold the standards of nursing profession strive to promote and project the positive image of nursing profession. I will keep my allegiance as a life member of this prestigious team in front of Almighty to promote and perform my assigned duties.
I do.
I do.
I do.
I do. And where is the clapping for all of the inductees? To all of
Thank
you.
Congratulations to all the inductees.
Congratulations.
Wonderful, wonderful. Congratulations to each one of you.
मीना जी आज कुछ नहीं बोला मीना जी
Yes, madam. Waiting for my time.
yeah I'm so curious
Yeah.
to listen your voice
Yeah, madam. Sure,
say
sure.
something
I was just waiting for to hear everyone. It was such a beautiful, awesome, and enlightening and enriching session. I just feel like it should continue. Go on hearing and empower yourself with such a big knowledge. Everybody poured into something or the other, and the head is full now, so that I can pour it somewhere else. It's damn good. It was so nice, and so many people have taken so much efforts to put this in, like Madam Nirja Sood, the other madam who presented very rightly, very practical point. She told that whatever research we do, it should not remain in the library, or it should not be only published, but it has to be implemented into the society, putting into practice, because nursing is doing. Nursing is not just sitting. It is going to the people, teaching them. That is very, very important. And we must celebrate this nursinghood, midwiferyhood, because I myself always stood first in community health nursing. My favorite topic, because of my talking, Otherwise, if people go to the houses, they shut the house. But looking at me, they open the house. Come in, madam. You always give something good. And even I taught my midwifery subject. It was my favorite subject. I stood first in midwifery. So I took the midwifery. I used to teach the student in labor room how those 9 stages the mother goes to a normal mechanism. Right from descent to the elimination of placenta. And let the child crawl and keep the child on the mother's abdomen. The child automatically search for the breast, and the breastfeeding starts there. So sucking reflexes starts right in the labor room, and then kangaroo care, rooming in. All these things are so important. And we have to upgrade our nurses for the real practices nowadays. What happens, the very high funda society people, they cannot bear the pain. So immediately they go to the doctor. Doctors are there to earn the money. So immediately they take them out for the cesarean section unnecessarily. Lot of immobility in high society. A low society people, low economic group, they keep on moving. So even on the road, they deliver. I conducted delivery in taxi. I conducted delivery in train. I conducted delivery in bus. And it was so awesome feeling. And they felt so nice. We all took the cloth around. We all took our dupattas around. And whatever blade I had in I just sterilized it, cut the placenta, and put the baby, and mother was so happy. So I saved the life of a mother and a child. It's a good experience to share, Once you are a midwife, you are a midwife. Once you are a nurse, you are a nurse. Whether you are PhD, MPhil, or whatever. But nurse. So even nearby people keep calling. So
Yes,
I
ma'am.
really appreciate. And one more thing I would like to tell you, that as soon as the girl child is born, from there the midwifery starts. Her nutrition begins right from there. As soon as the antenatal mother is pregnant and she is registering first time, from that time onwards, the care should start till the child is born and even after the child is born. If it is female child, the more attention is to be given. I feel so, because the gender equality is still to come in the society what we are living in India. In rural area, yesterday only I read that this was a 5th girl. So if anybody wants to adopt, because her mother is not accepting, father is not accepting, but so beautiful child, such a beautiful child,
Ma'am,
she took a 5th
sorry for the
chance. Yeah. So thank you
This
so
is
much, and congratulations to everyone who presented today. Congratulations, Madam Sukhanna. Thank you so much for giving me this opportunity. Madam Aisha Qureshi, she always appreciates me and gives me an opportunity. Madam Bimla Kapoor, knowledge, power of knowledge, and everybody bows down in front of the knowledge. And Dr. Muthu, Dr. Binu Jo sir, always there to help me to enroll the members. Thank you so much. This was my input from my side. Thank you once again.
Thank you, Meenaji. Thank you.
Okay, next.
Krishnaveni ma'am.
Yes, sir. So I request Sandeep sir, our President Sandeep sir, to kindly propose the vote of thanks. Let's hear a heartfelt vote of thanks from our President Sandeep sir. Over to you, sir.
Thank you, ma'am. It's always hard to say goodbye when we all want to enjoy each other's company to the longest possible time. But reality is different. We need to get back to our committed responsibility. My sincere thanks to our Chief Guest, Chapter Advisor, Professor Dr. Nija Sood ma'am, Guest of Honor, Special Guest, Keynote Speaker, Student Speaker, Founder, Patron, CC NSE ma'am, NSS President, Organizing Team, Presenter, Audience, and our lovely students. Last but not least, to our both Master of Ceremony who have done marvelous job to keep the program going smoothly. Additionally, thank to Mrs. Ruma and Mrs. Kuntla ma'am for developing a colorful PPT and brochure. Thank you all. Best wish and God blessing. Thanks one and all, and see you all in next webinar on 11th May 2025.
Good, good.
Thank you, sir, for your vote of thanks.
Thank you.
sir.
Welcome, ma'am.
Yeah. We conclude.
Full picture, Muthu sir, one picture.
Yes, ma'am. I think altogether, just
The whole, the
yes.
whole.
Krishnaveni ma'am, you can. I'll share the screen now. Just
Yes.
take.
Yes, sir. The lily flower is a symbol of love, innocence, purity, and fertility and rebirth.
Yeah. I hope our friends were there and our all the team from Lily chapter. Are they there?
Krishnaveni ma'am, just take out the screen. You just take out now. I'll take one photo. You just exit the screen now.
Okay.
Yeah, all of you.
Unmute your videos.
Yeah, unmute your video now. All of you to request you to unmute your video.
Yeah, so many people are not unmuted their video.
Yes, madam. I request all of you to start your video. Yes, madam, I have taken, but most of them they have not, madam, actually.
Thank you. Well, we can talk without any recording now.
Yes,
And
madam, now go ahead.
it was so wonderful to see Rathina ji. She took
Very
the
nice. Sorry.
yeah, he on that research committee.
Dr. Khanna, yes.
Committee. It is commendable. Commendable. Thank you.
Thank you, ma'am.
Yeah, welcome. And Swati ji.
My suggestion, one suggestion out of.
Please, please. Now we can hear.
Just a
You
suggestion.
can now, all of you can unmute yourself so that we can hear each other.
Just a suggestion.
Yes.
See, when we are developing a guideline for presentation, research presentation, we should request them to do only part of it, because in short time, you cannot do so much. Number
Concise.
2 is also to us as a speakers, to anybody a speaker, also give the minute to minute program. I think 3 to 5 minutes is more than enough for the dignitaries to talk about, because everybody knows their potential, everybody knows what their, their 2-3 points are very, very important, and that should be highlighted. Number 3, I felt that, when you are, the presentation by the speaker is being done, we can have a control, main control from the people who are organizing to, mute somebody or anybody, if you can manage that in future. Because we just did miss important things in between, and also the honored speakers could not talk the way they wanted to talk. So these are 2-3 suggestions, and we should go as per the program. In future, we can have a minute to minute program. If you have given me 5 minutes, I should stick to my 5 minutes, no matter how much content I have developed. I do lot of research, or whoever comes does lot of research, but I should do it within the minutes which you allot to me, because that not only saves the time, it leaves an impact. There's a focused message given by the experts, and that's what is important. I hope you will pardon me for saying this. Thank you so much.
Yes, my
It is
iron lady.
informal.
Thank you, ma'am, for your valuable input. Definitely, in future, we will do this, and we'll follow the PPT criteria and those things. And within 15 to 20 minutes, we will make our presenter to finish it up. Thank you so much for your valuable suggestion, ma'am.
Wonderful.
It's just out of
No,
this,
even
I thought
15 to
I'd tell
20
you.
minutes is also too much.
Yes.
Yeah.
We will take care, ma'am.
5 to
We
10
we
minutes.
have to
10
limit
minutes.
it 10. When we have master's
Maximum.
exams and all, we give them 10 minutes to present,
Yes,
and
ma'am.
then
Yes, ma'am.
yeah.
It's like we can do as like a paper presentation in forum, no? Like that we can do it in future.
Yeah.
Exactly.
Yeah.
Yes, ma'am.
Sorry, I think this was out of my, feeling I had, because, there can be technological error any time. We can't control, but other things we can
Wonderful
manage.
advice, and we will try to stick to that.
Thank you so much.
Surely, ma'am. We will admire. Khanna, ma'am, anything you wanted to add?
Anyone else wanted to say anything? Ashaji, good to see you.
Good to
I
see you
think,
too, ma'am.
Dr. Khanna, you need to go to bed. Don't you want to hit the pillow? Dr. Khanna?
Back.
I'm in
I
India
was-
now. I'm not in
Okay,
USA.
bye-bye. Bye, everyone.
Yes.
Bye.
Yes, ma'am. Thank you, ma'am. Thank you, ma'am. Take
Bye,
care, ma'am.
everyone.
Love you.
Bye.
Thank you, ma'am.
Nice to hear you all, and nice to see your loving faces.
Thank you, ma'am.
Thank
Thank you.
Ji.
Ruma, ma'am. How are you, Ruma, ma'am?
Ruma ji,
Ruma, ma'am.
Ruma, ma'am.
Yes, sir. I'm good. I'm good. What about
thank
you?
After a long time. After a long time.
Yeah. How
Thank
are
you, ma'am.
you?
Thank you for PPT presentation preparation.
Your student well.
Yeah, Ruma, you have done a good job.
Very well.
Thank you, ma'am. Ma'am,
Wonderful.
Manjari ma'am is also there. She is new member. Manjari ma'am, can you unmute yourself? At least you can say hello to everyone.
Yeah.
Ma'am,
Who all
namaste, ma'am.
is Sandhya?
Manjari Nandwani. She is a 10th star member. She joined 2-3 months back.
Good morning, all of you. Good morning. Good morning, Urmila ma'am. I've seen you after a long time. Hello, Maratina ma'am.
Hello.
Hello, sweet.
Hello. Hello.
Hello,
Yeah.
Aisha ma'am. Good morning.
And there are our others, 4 more. Maheshun and Sunita.
Sandhya Singh, Sandhya ma'am.
Yes, ma'am. Khanna, ma'am. Anything you...
Where are those others? Manjari.
Executive members of Lily chapter, please come. Madam, want to say something? All.
I see Indra Moses. Where is so nice to be attending. Yeah.
Yes, ma'am.
Where are you? I'm missing you in Canada too. We had such a good time. Why don't you show your face? Why you're hiding?
Namaskar, namaskar. How are you?
Good, great. And you and Asha ji, you show.
Nice to see all of you, all of you. Nice to see all of you.
Yeah. Miss that all that standing at a plant house and looking at the bottleneck buildings, right?
Mm.
Who else is there? Before we say bye.
Madam, in spite of busy schedule and being in army, Mr. Sandeep is doing a commendable job. So he really, we can give a big round of applause to him because he keeps
Yes,
calling
madam.
me,
Entire
keep
team only, ma'am.
asking me. He
Yes.
always
Yes,
asks
madam.
my guidance. Madam, how can I do this? Madam, how can I do? Please suggest some clinical nurse. Madam, are you free? Can I talk to you? So he is really inspired. I'm not now. I'm biking. I'm on ride or I'm doing something, and we are not allowed to speak on this particular time. Can we speak in the evening? So really doing commendable job as a president. You know, whatever he could put his input out of his duty services, he is doing. So I really appreciate him and big round of applause for him.
Thank you,
Mr.
ma'am.
Sandeep. Jai Hind. Jai
That's
Hind
true,
and
madam.
solid.
Yeah, that's true,
Salute
madam.
to you. Salute to you.
Thank you so for your continuous effort to have this
Wonderful. It's very nice to. Out of 7, our old original, these active executives of Lilly chapter, 6 are back. So we're so proud of them and they actively taking part. Unfortunately, only one person just told me due to church cannot attend, but others I thought they will be there. Prasanna was there and we are going to. I think I can see her there. Anyhow, my final good night. It is 1:30 a.m. here. And
Good
what
night, madam. Good night.
Mhm.
Have a sound
Night,
sleep.
Go and have lunch, early lunch.
Oh, early lunch. Okay, madam.
Thank you, ma'am. Thank you.
Thank
Thank
you
you, madam.
so much. Thank you, everybody. And have a fabulous Sunday here.
Nina ji.
Urula, ma'am, thank you.
Nina ji.
Thank you so much. Thank you.
Thank you, ma'am.
Manjari, nice to see you. Keep it up, dear.
Yeah.
Manjari, I'm so happy to see you there.
Yeah.
Yeah, keep it up.
Yeah.
Okay.
Can we leave now?
Yes, yes,
Minna
madam. Yes,
ma'am,
madam.
thank you. Thank you so
Yeah,
much
my
for joining.
pleasure. My
So it is
pleasure,
our pleasure.
Ruma ji, you did so well. Swati ji, you did so well. Then Radhima ji, you really presented so well, you know. And that student, little student, she took us back to the 15th century. My God, nice historical presentation of nursing. And Swati madam, very good. Bimla Kapoor madam was always awesome. Qureshi madam is really powerful. And Khanna madam, she gets us together in spite of night over there. Really, madam, it's a very commendable job what she is doing. Muttu sir, very nice. Every
Thank you,
time
ma'am.
there is technical error, sir is there. So we don't have to worry. Suddenly it was stopped. We message each other, what happened, what happened, what happened? And we are together. So that togetherness is very important because together we stand, divided we fall. On this note, thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you so
Thank you
much.
so
Thank
much.
you, everyone.
Thank you, ma'am.
Krishnaveni, ma'am, you just, you are the host now. Who is the host now? You can end the meeting otherwise.
Actually,
Yeah,
Swati
I
ma'am,
can
are you
end.
there? Yeah, sir.
No, who is the host?
Ma'am,
I think you can end the meeting now.
Please.
yes, sir. Swati ma'am, are you there?
Okay, I'll try to, because I cannot also end the meeting now. I am not
I'm
the
not
host
seeing.
now.
Swati was there.
Swati ma'am only, sir.
Or Binu sir.
I think I have joined back. Just a minute, ma'am. I could, end the meeting. Just wait, madam.
Try to please.
Ma'am, we have to plan for the 11th of May. We are running a short time duration.
Good. Very good. Active chapter. Nice. Wonderful. When we needed it, it just went out, and now we don't need it, it just doesn't go back. Huh.
So unmute, sir.
Deepak sir is a host actually. Deepak sir has to end the session because Deepak sir is a host now. Deepak sir. Deepak sir.
Yeah.
Deepak sir is a host.
Deepak says she.
Ask him, Deepak.
Yes, sir.
Smile.
Yes, ma'am.
Oh, I wanted his picture and now he's gone.
Ma'am, you have a Deepak sir number. You just call him now at least.
No, sir. No, sir.
Sandeep sir, you have?
No, sir, I have not. Deepak sir.
Okay, then leave the meeting. Then everybody will leave the meeting. Let him. I think automatically it will be.
Okay,
Yes.
sir.
Yes, sir. Thank you. Nice to meet you. Thank you. Bye. Have a nice
Thank
day.
you, sir. Thank you, Muthu, sir. Thank you, sir.
Ma'am, I'll text you. I'll take your number. We'll have a
Yes,
discussion.
sir. Thank you so much. I too, sir. Thank you, sir.
No, thank you. Bye. Sandeep sir, bye.
Bye, bye, sir. Bye, sir.
Yeah, the meeting, please.
यहाँ से बेलापुर जाना हो तो नखरे देखो इनके जाओ
बिल्ली कौन सा है? ट्रे कौन सा है? ये किसका है?
ये ट्रॉली को छोड़ दो, निकाल के उसे छोड़ दो।